During pregnancy, approximately 50% of women experience back or hip pain, and 25% of women continue to experience pain up to 1 year after giving birth. Back and hip pain are debilitating conditions that can result in disability, depression, and reduced quality of life for pregnant women. We conducted a review of all available research to determine if exercise reduces the risk and severity of back or hip pain during pregnancy. We found that although the risk of developing back or hip pain during pregnancy was not changed, women who exercised during pregnancy had a large reduction in pain severity, both during and following pregnancy. Beginning or continuing to engage in activities such as walking or swimming during pregnancy can be an effective way to have a more comfortable pregnancy. For more information on the development of high blood pressure during pregnancy, also known as gestational hypertension or preeclampsia, affects up to 10% of women. These conditions can be associated with maternal illness, a smaller baby, and preterm birth. High blood pressure during pregnancy is also linked to an increased risk of developing cardiovascular disease later in life for both mother and child. Therefore, preventing or treating these conditions is very important. However, effective therapies are still being explored. We conducted a review of available research to determine if exercise during pregnancy prevents preeclampsia or gestational hypertension. We found that women who exercised during their pregnancy had an incredible 40% reduction in the risk of developing high blood pressure. Beginning or continuing to be physically active throughout pregnancy can have incredible benefits for both you and your baby. Women are encouraged to speak with their healthcare provider if they have any questions or concerns about their blood pressure during pregnancy. Pregnancy and the early postpartum period is an exciting time in a woman's life, but the abrupt change in lifestyle, lack of sleep, and increased stress can be overwhelming. Approximately 13% of women are affected by depression during pregnancy, which is linked to an increase in the risk of postpartum depression as well. After delivery, up to half of all women experience depressive symptoms, including feelings of sadness, irritability, difficulty sleeping, or loss of appetite, and 22% of women develop postpartum depression. After delivery, some women experiencing depression may find it more difficult to bond with her baby. Therefore, prevention and treatment of pregnancy and postpartum depression is critical to the health of both mother and baby. While antidepressants and psychotherapy are known to be important and effective treatments for depression during pregnancy and the postpartum period, it is increasingly recognized that exercise may also be an effective preventative therapy. Recently, we conducted a review of all available research examining how exercise during pregnancy affects the risk of depression and the severity of depressive symptoms. We found that women who engaged in moderate intensity exercise for at least 150 minutes per week had a significant decrease in the severity of depressive symptoms and a 67% reduction in the chances of having depression during pregnancy. We then conducted a second review examining the impact of exercise initiated in the first year after delivery. We found that light to moderate intensity exercise improved depressive symptoms and reduced the risk of postpartum depression. Experiencing depression and anxiety during or following pregnancy is common. However, women should know they are not alone and that prevention and treatment are possible. All women are encouraged to talk openly with their healthcare provider and learn about the signs and symptoms of depression and discuss what may be the best prevention or treatment option for you. For more information on exercise and pregnancy and the research.
Pregnancy is a thrilling but potentially worrisome time in a woman's life. Many expectant mothers have questions about what is safe and beneficial during pregnancy. It turns out there is one simple and safe thing that can be done throughout pregnancy which benefits both you and your baby. It can be done in the comfort of your home, the great outdoors, or wherever you like to spend your time. It is fun to do and has minimal cost. I'm talking about exercise. Now, when I say exercise, you may think of intense activities like running or circuit training that make you out of breath and sweaty. Sure, that type of exercise can be done during pregnancy within reason. However, research continues to show that even less intense activities are extremely beneficial for prenatal health. My name is Margie Davenport, and I'm the Director of the Program for Pregnancy and Postpartum Health at the University of Alberta. We are a multi-site research program aimed at improving the lifelong health of women and their children. As the mother of 2 young daughters, I understand the importance, benefits, and difficulties of being physically active during pregnancy. Current Canadian guidelines encourage almost all women to engage in at least 150 minutes of moderate intensity exercise every week throughout pregnancy. So, how do you fit in 150 minutes of exercise into a busy week? It is important to choose activities that are fun and accessible. You can do aerobic activities, such as walking or swimming, on their own or in combination with resistance training. In fact, just going for a 30-minute walk 5 days a week provides incredible benefits. If 30 minutes is too long, try going for a short 10 to 15-minute walk after lunch and dinner every day. When you are pregnant, there are definitely going to be days where you're feeling tired or unwell. It's really important that you listen to your body, but always remember, even a little physical activity is better than none. In fact, light exercise may even help you feel better. So why do we encourage pregnant women to exercise? Our recent work has demonstrated that there are many evidence-based benefits of being physically active during pregnancy. Studies from our lab have demonstrated that exercise improves mental health, decreases the severity of back pain, reduces the risk of gaining too much weight, and can decrease the risk of developing common pregnancy complications, including gestational diabetes and preeclampsia, without increasing the risk of preterm delivery or having a miscarriage. And finally, with an increased fitness level, labor can be easier to tolerate. I mean, they do call it labor for a reason. Incredibly, research demonstrates that your unborn baby also benefits from your physical activity. Exercise helps the placenta to grow and function, which means your baby receives more oxygen and nutrients. Newborns of mothers who exercise are more likely to be born at a healthy weight, which is linked to a lower risk of being overweight during childhood and later in life. It has also been shown that a mother's exercise can improve her baby's cardiovascular health, cognitive function, and language development. Our team at the Program for Pregnancy and Postpartum Health is actively investigating the impact of prenatal physical activity on the health of both mother and baby. Regardless of current health status, all pregnant women are encouraged to talk to their healthcare provider about prenatal exercise. This is important because some women with medical issues, such as preeclampsia, should not engage in more strenuous activity during pregnancy. However, normal activities of daily living may be continued. Your healthcare provider can advise you if they have any concerns, but the majority of women will be encouraged to follow the recommended guidelines of 150 minutes of moderate intensity exercise each week. Our goal at the Program for Pregnancy and Postpartum Health is to provide women with the knowledge and guidance to achieve a healthy pregnancy. After all, a healthy